Welcome back. Let's talk about what the evidence can do, what it can't, and the new tools arriving fast. First, evidence based dentistry. The strength is real. EBD integrates the best available research with clinical expertise and the patient's own values, and it disciplines practice against mere tradition and habit, against doing things a certain way, because that's how you were taught decades ago. That is genuinely protective of patients. But the limits matter just as much. Large areas of dentistry simply lack high quality evidence, and absence of evidence is not evidence of absence. That's a reason for humility, not for paralysis or fabricated certainty. Clinical guidelines inform judgment, but they cannot replace it. And guidelines can be captured by the same interests we discussed last video. And the deepest limit, evidence tells you what works on average. The patient in your chair is an individual whose situation may not match the trial population. EBD is a tool for judgment, never a substitute for it. Now, four emerging technologies, and notice that each new tool hides an old ethical question. AI assisted diagnosis, powerful pattern finding in radiographs. But when the algorithm misses a lesion or overcalls one, who is responsible? The answer this book gives: the dentist. AI assists judgment. It does not replace it, and it does not absorb the liability. Digital dentistry and CAD-CAM, faster, more precise fabrication, and a duty to stay genuinely competent with new tools, not just to push buttons. Teledentistry, the most justice relevant technology because it can extend care to underserved and remote populations while raising real questions about whether the standard of care can be met remotely and how consent works at a distance. And 3D printing, custom fabrication in office, which makes quality control and material safety your direct responsibility. The pattern across all four: new tools, but the enduring questions: competence, responsibility, and the patient's good. Technology changes the instruments, it never changes the obligations. Next video: the hardest material in the chapter, telling the truth about your own mistakes and the duty to report a colleague.